comments on the importance of the public-private partnership. And we are recording, if just to flag that for you as well. But we welcome your comments here today.
Okay, well, thank you so much. And actually, Dr. Bergeron wanted to be doing this, but when she was unable, I always love to have an opportunity to, address community action agencies, because we do go way back. And I don't know if Clarence is still on the line, but I can remember in the early 2000s when Clarence was director of the Office of Community Services under President Bush. And for the oldies and goodies out there, if you remember Peg Washington, we had, I think that's really when we forged from a federal level, Office of Community Services and the Office of Head Start, a really intentional and serious relationship over the years. And it's, as you know, maintaining and sustaining any relationship is hard. But at the end of the day, we always look at the benefits of what we can contribute and leverage, not only from our knowledge about our grantees, just to make a better environment, not a gotcha environment, but an environment that's looking for systemic change and growth over time. And I have to say, when you see what so many CAP agencies have accomplished, I would say over the past 25 years, and what they are doing right now during this epidemic is extraordinary. It's interesting because I'm coming to, the end of my Head Start career, and I have to say, I think the work, as you attributed, the nimbleness and the body of work that the Office of Head Start has done during this pandemic is about as important a piece of work that I think we have ever done. And I think the underlying theme of everything is looking to the community action agency world saying, you got this. You've got the tools. You've got the data. You make local decisions. We can give you some high-level guidance. We can give you flexibilities, but everything is really within their local powers to really support families and children during this time. It's been extraordinary. And I think as much as we all hate the tediousness of being homebound, although I love wearing flip-flops every day, I think we've all learned, and particularly in our programs, they're learning some things that are going to be practices that they're going to carry on even when the pandemic is over. Just one example is, policy council meetings. That's important, that whole piece of policy and involvement. There is better participation on Zoom of parents who are elected members of the policy council than there was worrying about, am I going to get to the meeting? What am I going to do about transportation? What am I going to do about childcare? So I think we're learning a lot that we need to embrace as we move past this pandemic. I do think when you talk about relationships, clearly, that, I have to say from my own observation over 25 years, the most robust agencies are those that are partnering with a variety of partners, not only at the local level, but at the state level. And I think that's, even during this time, it's so much more, it's even more important. One thing you mentioned, the childcare desert. The one thing that I am really very concerned about, and I feel like we're not getting enough exposure on it, we know that if families who are already under stress have been captive in their homes, that there is more child abuse, more domestic violence, stressors that, and so we know that our families not only were coping with the kind of everyday things that they coped with so beautifully, we now layered on this environment wherein we expect our parents to be full-time teachers while they're trying to manage 4 or 5 kids at home, or, so I think whatever we can do, this whole notion of, our partners have got to be with us on this. We have got to figure out whether or not it's telemedicine, which, we have examples of programs where children are receiving occupational therapy through telemedicine, and it's working. So I think this is uncovering. I think the whole field of medical support and mental health services, I think we were on the verge of a lot of change. This has just forced us into practices that seem new and a little bit weird, but they're really helping our communities. I think the other thing about the partnerships, we have got to, and I think Dr. B has been so superb on this, being proud to say we want to partner with the superintendent, we want to partner with the local principals, and Dr. B has done this pilot, and we have superintendents going, wow, I never knew what Head Start was all about. We never owned it. And what you see is the whole reputation of Head Start being elevated within these school systems. No one is saying Head Start should go to the schools, and even the superintendents are not saying we want that. But to be partners, I think is so critical. And I think community actions are so posed to be the ones to initiate those partnerships, just because of the strength and I think the nimbleness that they've always had. The other thing that I worry about, I want to get back to the health thing a little bit. You know, we're certainly worried about cognitive delays with our kids, you know, being out of school probably it's going to be almost a year before they kind of get back in those settings where they really have the kind of ongoing instructional support. I think about our special needs kids in particular. I think about how much it matters if kids have tooth decay that they can't attend. And what we see now is we have a medical community that's so backed up that in terms of appointments, even for me personally, I can't get the doctor's office to call back because they're so busy. So I think about supporting, and we know how important health is in terms of the overall social emotional development of our kids. I really think that this, again, is an area that I just feel like community action agencies have that upper edge in being able to make those partnerships to figure out how to get those kids the services as quickly as possible when they're able to get to the doctor's appointments. I know years ago we used to do a lot of programs. We do a lot of transporting of parents to appointments. Kind of think that kind of diminished over the years. I think we need to think about those kinds of supports that we used to provide that really facilitated those kinds of engagements that are so important for children and families. I also think, it's interesting, as I think it was Aaron that talked about this dual sort of the pandemic and the whole issue of racial equity. I know some people in the audience were like me. We grew up in the 50s and 60s and observed, even as children, the whole civil rights movement. And of course, we both came out of that, right? Community action agencies and Head Start. And it was a time of unbelievable change, ended segregation as we knew it, but we now know it didn't go far enough. And I for one, I think we're learning a lot about, I think the whole issue of racial equity is just being so exposed even through the COVID pandemic. I feel such hope. The prospect of significant change emanating from our communities and demanding change. I think this time is as big as the civil rights movement. And I think that community action agencies, along with Head Start, are going to play a major, major role in this. When I think about, racial equity, we are starting to do it in the classrooms with our children, because that's really where it starts. But I think these principles of what's going to make it better for our communities, I think is something that's got to be embraced at every level of a community action agency. I get back to the board has got to get it. The administrators have got to get it. And every one in the diverse population, the work population, the workforce of community actions is probably some of the most diverse in this country. The opportunity for really influencing real and lasting change, I just think it is endless right now. And we have got to capture this moment. We have got to capture this moment. And again, I think of the diversity, not only in services and people within our community action agencies. Man, there is a call. It is a calling now. And I really think it's So many have stood up, and so many are so stellar. But man, we got to pull ourselves, every one of us, up together, I think, to make these changes. I think there are rising winds. And if we don't take this opportunity, I think that we have blown it. And I do think getting back to, it's the partnerships, and you can't nourish and sustain a partnership if you don't work at it. And I think we all feel like, we don't have time, or do we have time? I'd like to talk to that CSBG director because I know he's got knowledge on it. We have got to make time to talk to each other. So we really are benefiting from our collective knowledge, so we can all do the best job we have. So for me, it's, someone talked about a transformative time. It is a transformative time. And to think that we can be part of this, and instill that level of compassion and hope, because it is also about still instilling hope. If you can't have that vision of hope, then it's hard to take the action. So if I say anything, it's nurturing the relationships, and it's reaching those tentacles that you have as far out in that community. And it's always that, for me, the balance, the struggle between the urban and the rural. Both have tremendous needs. And again, we have our community action agencies represent that whole spectrum of incredibly remote, areas to in the inner city. So I just think that this is, for me, a hopeful time. And I think Congress and the Office of Head Start, I think that they have done so much to be supportive of allowing us to allow you, to be as supportive as you can with families and flexibilities. And I have to say, Dr. B's leadership has been, she's been pushing that envelope, and will continue to push it. And that's been so freeing for all of us. So I don't know, Denise, any comments or thoughts? And I do want to say, and I do want to harken back to, Katrina and Maria were two of the 5 worst hurricane disasters ever in this country ever experienced. Mm-hmm. When I think back, and I think about friends in New Orleans and, the friends in Houston, when I think about what the community action agencies did to support each other, to take in families that fled from, one part of a state to another part of a state, or from, Louisiana to Texas. And when I think of, you see the examples, even though Sandy didn't, equal the disaster of Katrina or Maria, again, those CAP agencies in Hoboken, and just thinking about how they opened their doors and how they were such a catalyst for the entire neighborhood. For again, there's so much to be so proud of, and you think so, and I think in these times you see these examples of such shining, elevation of everything that a CAP agency is capable of doing, just absolutely burst in these kinds of times. So I guess, I'm not passionate about much, but, I just feel like we are in a time that we have got to capitalize and make it the best. And I just feel I'm extremely hopeful for community action agencies, hopeful for Head Start, and hopeful for our country.
Oh, and you're just giving me a sense of a chills here running down my arms. The motivation, the inspiration around hope. And I think about the community action promise, where community action, changes people's lives and it embodies that spirit of hope. You've really captured, I think, so much of that energy that can really happen at the local level. We had Wayne Metro on with us earlier in the Detroit area, who runs a number of Head Start programs, and really putting racial equity and person-centered as their core approach across their organization. Yeah. It's been great to see. You also, I love your frame of rising winds, right? Mm-hmm. These moments in time don't come around, and we need to step up and step into them. Yeah. Another thing that Wayne Metro is doing, I think, in terms of really nurturing and strengthening partnerships. They've taken some of their CARES dollars and have done many grants out to other nonprofits in their local community.
Mm-hmm.
That public-private partnership is critical.
Oh, sure. Absolutely. Absolutely. I mean, even looking at, it's interesting because you have seen some businesses grow during these very difficult times. You think of all the suppliers now that, Head Starts are turning to and forming relationships with that they've never had before because they're going to need things that they never knew they would need. And they're going to need them on a recurring basis.
Yes.
So even forging these, the local businesses, I think about the food industry. How many programs have reached out and said, we got to get creative ways to safely deliver food to our families, whether it's, the elder care or whether it's our young kids. I just think there also had been, where we can forge with our business partners. Because they're an important also part of the community for the overall sustainability. So again, I think that there are just so many opportunities.
Mm-hmm. Well, and I having Dr. B offer flexibility across the network, that agencies are able to pivot to home delivery, to supplies, to keeping those staff employed so we can have a workforce readiness taken care of. It's again, a model for the federal government. So you guys should all really be proud of the work that you've been doing during this pandemic over at OHS. So,
well, we are, I have to say, it's extraordinarily proud to be part of this incredible team who have worked their butts off. And I cannot tell you. But it's all been consistent. We trust you. Here's the guidance we can give you. You're going to make the best decisions. And that confidence is well earned.
Well, I've been on the phone with you and Dr. B, and you both said this is not about a gotcha. This is about what's right for families. Yep. And that is the most solid footing you can ask any agency to try to jump from, is that the trust is there.
And, I would put a plug in for, our ECLKC, our website, go to the COVID page. There's so much information there, so many Q&As. And I think that this is going to be, I think the challenges in terms of the internal systems for CAP agencies, they're probably going to have to develop new HR policies that they never knew they needed in the past. So I think some of those things about, is my agency going to treat me fairly or not, or am I going to lose my job if they don't need my job anymore? I think this is going to be a challenging area, but I think to thoughtfully think through, do we have all the policies we need? And what do we need to develop internally? Because hard choices are going to have to be made over time if things are going to look different. And I think agencies want to be as prepared as they can for what they can predict is coming down the road that they've not really dealt with in the past. So I just say that because because people come to us and say, they're being unfair. And we always say, well, you know what? Take a look at the policies. It's with, is the agency within their authority based on. So I say that. I know that that's a little bit of a deviation from, closing remarks and inspiration, but I have to get back to the little business points every once in a while. But again, I do like the rising winds, and we just gotta, go with it and make great changes.
And at times it can feel intimidating that you're asking me to be the ones, right, as a network to make the change. Yes, we are, because if not community action, if not Head Start, there's not this other army out there, right? This is the army that's fighting the war on poverty every day. So,
yeah, absolutely, absolutely, and we do know that the whole poverty. I mean, look at our homeless population.
Yeah.
I mean, we're talking about the number of kids and families that are eligible have probably risen by very significant percents. And I think the hardest thing for programs is going to figure out if your capacity is half of what it used to be. And let's say you've got 200, 500 families that want to come back, and you could only serve 300 of them in a traditional setting. How do you decide? Yeah. These are grueling decisions that grantees are going to have to make. because they may not be able to serve the numbers that they served in the past and the way in which they serve them. I mean, we're going to push and say, if you can't serve them all in this way, how can you still serve families in other ways? So, it's challenging, but again, you got to believe with the support Head Start's embedded in a CAP agency. You're looking at so many more resources to rely on, to refer to. And even, we talk about relationships with external partners. The most important relationship is a relationship between the Head Start and the community action agency that live together, that are married. Because sometimes that's a relationship that's a little bit tricky in of itself. And this is a time really where coming together at every level is critical.
Mm-hmm. A question come in the chat in terms of, you mentioned about that when you're going to have to make these tough choices. Is there any sort of guidance, places you would go to help agencies figure out how do you narrow that caseload or narrow that classroom size, and who do you prioritize?
Well, I think I think we have said some of the HR choices. I think this is new territory for a lot of us, and I think there are HR professionals out there that people need to consult with or consider when they're thinking about developing new internal policies. But, the only advice that we have given, because these are going to be tough choices, the only advice that we have given is that we think if your capacity is going to be reduced, we think that your obligation to those children and families that are returning for that second year should be honored. I think you sort of need, I think our guidance has been, if you can take care of the returning families and then figure out, do you have more capacity? And then you start, selection criteria is going to be very important. People may need to look at the selection criteria. If you've got wait lists, do you have a selection criteria now that really sort of ranks and weights in a way that's consistent, with the current conditions? Selection criteria can be changed every year depending on, it doesn't have to be something that never changes. And again, how do you figure out what's most needy? That's a challenge on any given day. Mm-hmm. But how you figure it out now, because I think programs are all going to have wait lists. And that's going to be really, really hard. I do think, we talked about the relationship with the public school system for all the right reasons. I think there are still, within our CAP community, some agencies that say, we do a much better job with those 4-year-olds in the LEA, but we need to consider resources. If there are openings, then maybe some discussion should be, let's push those 4s to pre-K and let's do more 3s or 2s, because I think, again, nothing is perfect, but we have to look at the resources and maximize all those resources. And if we can move some of our population to pre-K, then it's going to open up some resources for other kids that you would otherwise not be able to serve, and mostly kids that are younger. Hard decisions.
Not easy, that's for sure. But you're thinking about duration, though, and honoring promises made, perhaps.
Yeah.
And need, I think it's not going to be easy, and it's probably going to fluctuate all across this country, as it is. That's what it's always done.
The other message that we say, we don't, things is, Dr. B would often say, I give an answer last week. It's not my answer is no longer applicable this week because something has changed. Mm-hmm. And so we recognize the community action agencies, as they're planning for what they think they can do this fall, it could change by October or November. Yeah. We had one agency that opened up 24 centers. The first week they had to close 6. The second week they closed, I think, 7 more. And by the third week, they were all shut down. We are saying to folks, you don't have to ask us permission. If you're changing your design, if you're doing a locally designed option, if you're doing combination, you figure it out. Just inform us. You don't have to ask for permission. But it will be important for us to understand all the shifts and changes program made, because Congress and we are also How do they cope? What was this experience? How did they use the COVID? How did they use the CARES Act money? So again, it is not about looking to us to say, can I do this design? Can I reduce my kids to, 10 in a classroom or 8 in a classroom? Those are decisions. I mean, CDC has some general guidance. We're saying, hey, we want, two employees in that classroom, at that preschool classroom. Even if you're down 8 kids, we still want, a teacher and a teacher aide. But again, whether or not you reduce it further, or whether or not you have it larger because your community has less spread, these are, again, we're saying you can look at general guidance, but then you have to look at your specific community. And what we care about is that you're making informed decisions. That's all.
Mm-hmm. Well, someone put in the chat window that today you've reminded them of their why. And we asked you to offer closing kind of inspirational remarks, and you have certainly done that today in the midst of an increasingly burdensome time. So thank you for all you do, and thank you.
Denise, I just want to say history is very important. And if we do not teach our generation, or remind our generation or generations to come behind us what happened in the 60s, we will lose our purpose today. Mm-hmm. So if the history was helpful, it helps me to remind myself also. So thank you for the invite. It's always great to see you, and love working with the community action agencies, and bless us all as we go forth. That's all I can say.
Thank you so much, Ann. We appreciate you, and give everyone back at the Office of Head Start our best, and Dr. B as well. So we'll wrap up here, but you have a great rest of your day, and we'll talk to you soon. Thank you.
Okay. Thank you so much. Bye-bye.
Bye-bye. All right. Well, that was fantastic. Ann is such an inspiration, and it's wonderful to have had her with us for a chunk of time here this afternoon. So that's great. Just keeping an eye on the chat window if there's any last few things. Erin is noting that later today we have a webinar in support with the National Head Start Association 0 to 3 and a few others on Head Start and early Head Start programs and funding around state investments, which looked a little different probably a year ago than it does today, but it's still going to be an incredibly important webinar. So that starts at the top of this hour, 3 o'clock Eastern on noon Pacific. And other folks putting into the window, sharing CARES dollars like Wayne Metro did in terms of subgrants is a great way to express the value of kind of that collective impact. And now we need to get to work. A lot of great ideas have been put on the table here today. Erin, I'm going to turn the ball over to you. I know we're maybe a little shy on time, or a little early, but no one usually cares too much about that. But I'm going to turn over to you for our last cleanup here and the next steps. So I'll turn it over to you.
All right. Thank you, Denise. I just, before we wrap up today, I wanted to address a comment that came up in the chat about equity, racial equity, and why that wasn't one of the categories in the poll question, which is a great question to ask, the types of questions we should be asking ourselves and each other. I would answer it this way. Equity is definitely an area where we need to do some capacity building across our network. But I think maybe even more urgent than that is that we take action in the area of equity, and that we implement equitable practices. And so one of the selection criteria, and it's a required selection criteria for all HCCT initiatives, is that they have to address equity. Whether they have equitable outcomes as their intended goal, or whether they have some other intended goal, the initiative still needs to demonstrate that it is moving the ball forward in terms of equity. And I know that our communities are diverse, but one thing that I think we can say very confidently is that there is no community in America in which equity is not an issue. And equity is really at the center of the structural poverty that has plagued our nation for generations. So it will be prominent, and it will be central to our HCCT initiatives. And I want to appreciate all the voices that have spoken up and that continue to speak to this. We need to be a network that speaks it and does it, and in HCCT, we'll definitely see that, just as we've seen community action live that ideal in so many other ways throughout our history. I just want to thank everyone. Oh, I'm sorry. My colleague Tiffany clarified, inequity is at the root, not equity. I misspoke. So thank you for that clarification. That was an error on my part. The selection criteria, by the way, those will be released as a formal document in the very near future. The document that exists as a draft is reflective of what the criteria will be. So if you have that, you can use that. If you don't have that, I can share that with you immediately. We haven't yet posted it on the HCCT landing page. But what we're going to be doing in the very near future is sort of expanding that document with some examples and illustrations, so that the criteria can be a little more easily understood in terms of how we should consider applying them. So keep your eyes open for that. But if anyone is in need of the selection criteria urgently, we just contact me or Courtney or Lauren. We can get that to you. I want to thank everyone who has participated and engaged in this discussion today. I particularly want to thank our presenters from the Office of Community Services, from the Kresge Foundation, from Metropolitan Community Action, Metropolitan Action Commission. Thank you, Denise. And Ann Linehan from the Office of Head Start. I think this has been a very energizing day. I hope it has been for all of you. If anything is clear from our discussion today, it's that we have an amazing opportunity in front of us. We're in a difficult position as a nation, but community action has always risen up to meet the challenge, just as it did during ERA, as it did during Katrina, as it has more recently with tornadoes in Nashville. We always rise to the challenge, and we've got probably the challenge of our lifetimes right now. So I want to thank all of you for the work that you do, keeping the promise to all of us, the promise of community action, and that we care about the entire community. So we'll have more resources and information coming down the road, and we look forward to working with you and sharing those. And again, thank you all for your participation and joining us in today's event.